Right now, I would like to welcome all the regional activists and participants who endured tiring flights and headaches that come with OR Tambo International Airport's Immigration Office and Cape Town International's baggage claim to be here. I would like to welcome all the international trans experts, activists, and service providers from various countries who took time off their schedules to be here. I would like to welcome the South African participants, the media partner organizations, Iranti and Gala, representatives from the Global Trans Research and Advocacy Project, and the various service providers that are presenting and are participating in this process. And lastly, we would like to welcome the representatives from various funding partners, OSI, OSISA, OSI East Africa, ARCUS, HEVOS, COC, the Other Foundation, AJWS, AMFA, Astria, and the Wheat Trust. We really hope and trust that this will be a safe and constructive platform for academic, advocacy, and social conversations with a broad range of stakeholders in order to advance trans health and human rights in Africa. And now you must note that this conference comes at a critical time when 7 UN bodies, OHCHR, UN Women, UNAIDS, UNDP, UNFPA, UNICEF, and WHO have released an interagency statement that aims to contribute to the elimination of forced, coercive, and otherwise involuntary sterilization. We trust that you will enjoy the conference, contribute with your expertise and knowledge, and learn from others. So partners, colleagues, allies, activists, service providers, participants, welcome to the second Transhealth and Advocacy Conference.
I had the patriarchal face. When you get in a space and you start talking about sex, we all get excited. And I think sex is a good thing. So we ask ourselves, why is it important to talk about sex? And for trans people, it's one of the challenging issues when we talk about sex. Because we want to feel the pleasure, we want to express our love, and we want to get pregnant, we want to impregnate. And all this comes with a challenge for a transgender body person. Right now in Botswana we have a new Public Health Act, which what pisses me off with it is that the doctor now is given the power to disclose your HIV status without your consent, and also the doctor has the power to perform a surgery without you consenting and saying this is what So imagine if you are born intersex and your mother is not consent to the surgery and the doctor performs that. We may be participating at that level, WHO level, but in terms of coming down and how to implement, it's totally different. When you are in a country that does not recognize the trans or intersex people, then it becomes even worse for you to then sit with the government.
We're very excited that there is now a trans activism that's really taken root, and we're very happy to be at the forefront of supporting that conversation. It's important that we have a conversation that's African. We have learned from our experiences in how the conversation around gay and lesbian rights have evolved. We've learned from that experience that yes, it's wonderful to have a global conversation. It is important though that a part of that conversation needs to be rooted in our realities, in our cultures, in our language, in the indigenous knowledge that we have created over many, many years. And I think the trans movement has been brilliant at bringing forward the issues that is unique to the movement. For the first time, the conversation has gone broader than just the health and rights of trans people. We're actually beginning to talk about the spouses of trans people, the partners of trans people, the children of trans people, and how much of a journey it is for them as well. Really exciting stuff for us as donors, because in the end we want to have a world that is equal for all and that takes into consideration the needs of all. So that to me is very exciting. The fact that trans people have the opportunity to find their own research agenda, I think is so incredibly important. It's very easy for academics, donors and other people to say what we think should be researched. So it's exciting to hear what trans activists and people just living their lives as trans people, what they feel. What I found very exciting about this conference is just hearing how far the conversation has come amongst the people from the medical fraternity, how far the conversation has come among psychologists and psychiatrists. If I think back to when I studied psychology and how little was known about being trans and where things are today, we're worlds apart. And I think that is, again, it's a lot of progress in a very short space of time.
I think I speak for all of us when I say both the South African trans activists and those in the region have come out of the house of gender dynamics, and something has to be said about that. So it gives me great pride to be presenting you with the Pioneer Award from SHE for your contribution to the movement. Thank you and farewell.